Welcome everyone to the fourth webinar series of ASAP. It's our local partner training and webinar series for Pepfar local partners, Usaid Pepfar local partners. We're excited today to share with you about Usaid budget, preparing for your Usaid budget. Tomorrow, we also have another webinar on Usaid expenditure reporting. Both of these topics are really important for your awards and for planning and reporting coming near the end of the year as well. But given what we know is going on across the globe with COVID-19, we thought it was an important opportunity to take the first half an hour of this webinar, and tomorrow also to take a half an hour to respond to some questions you may have and to gather your questions if we can't respond now and try to respond as soon as we can. This is a very fluid and ever-changing situation, and so some of your questions we may not have answers to, but we'll do our best to try to respond, and if not, come back to you if we can. So we're lucky to have George Cyberry, who is in our Office of HIV/AIDS, leading up a lot of our efforts on COVID-19 for our Pepfar programs. And he'll take some of the questions and respond to some of the questions we've gotten in already from the survey. ASAP sent around a survey a few days ago, so we've gotten a few responses and some context of what's going on in your countries. We're going to share those and then go to questions and answers. So I'm going to start with that. And as a reminder, the survey is still open. So if you have additional questions you'd like to submit, please do so in the coming days. So we got responses from all the countries you'll see listed here, from quite a range that we work with. There were 16 countries, 38 people responded, and on average there are 36 confirmed COVID-19 positive cases across the different countries, and in some countries with already 554 cases reported. We asked what governments have been doing already. Some have closed borders, some have closed schools, some have shut down large gatherings of 30 people or more. There are other measures that countries have been taking, and we know in individual countries it varies greatly. We asked the question, is USAID provided guidance related to COVID-19? The vast majority said yes, but in a few cases you still haven't gotten or haven't received guidance from USAID related to COVID-19. And has your office made any changes in operations due to COVID-19? And the vast majority, 90%, said yes, you've made some changes already. We asked about working remotely, and in a few cases, everyone is already working remotely. 30%, most of the staff are working remotely, working at home or not in the office. And you can see across the categories, but it looks as if in most cases some are, but still 22% of those who responded are still working in your offices normally. We asked about some of your concerns on implementing Pepfar programming during COVID-19. People are worried about ability to meet their targets, their HIV targets. Concern around activities that involve large gatherings, which are not allowed in some countries now. Worry about accessing the target group and supply shortages. Concerns around missing, for PL/HIV, missing appointments and loss to follow-up. Concern around equipment, protective equipment. Implementation of community programs, again related I think to kind of in gatherings in communities or outreach in communities. Worry about lack of knowledge and what could potentially be fatal cases, and fear and risk of being infected during service provision as well for those who are providing services. And lastly, concern around transportation. If transportation means are shut down, how will people get to services and access the communities you're trying to serve? We asked, are community outreach activities still continuing? And 60% yes, 40% no, those have been stopped. and looked at what safety measures are in place. In some places, face masks, gloves, a lot have access to hand sanitizers and some other types of safety measures. So with that background, I'm going to turn it over to George Cyberry. And as I noted, he works in our Office of HIV/AIDS. He's a medical officer in the adult clinical branch in our office and has been working around the clock on COVID-19 over the last few weeks. So I'll turn it over to George, and George, I'll let you do a brief introduction and then we'll turn to some of the questions that we have gathered. And then for those on the phone, those linked in, please chat us your questions in the Q&A box, and we'll start reading through those as we go once George gets through the initial set of questions. So please continue to input questions while we're going through these first set of questions.
Great, Deb. Thanks very much. And maybe I can have you turn back to that slide that listed some of the questions that came through the survey, just so that's up in front of us for guiding the discussion. It's a pleasure to be here today to talk to folks who are on the line. These are really difficult times, and our goal is to try to anticipate the kinds of problems and concerns that are going to be faced and figure out together how best to deal with those. Our office at Usaid, the Office of HIV/AIDS, is mostly focused on the Pepfar programs that we support to make sure that we find a way to ensure the continuity of HIV prevention and treatment services in the face of this COVID-19 epidemic. There are other parts of Usaid and other parts of the US government that are focused on the COVID-19 response itself. But for today, I'm really going to focus on what we can do to ensure that we have continuity of HIV prevention and treatment services. Folks have we put out through Pepfar in a Pepfar-wide way guidance about how to address HIV services in the face of a COVID-19 epidemic, and that has been shared. And if you haven't received it, please message the organizers and they can make sure that you have access to it. That really does begin to outline a lot of the common problems and questions that were anticipated, and we expect to update that once or twice a week with additional questions as new concerns and information arise, and based on the kinds of questions we get from you. What I would say in general terms is our goal is to find a way to modify and adapt both treatment and prevention services for HIV in a way that protects the most essential elements and protects the people who are trying to deliver that care. Both of those are really important goals for us. We realize that not everything will be able to be done. It certainly won't be able to be delivered in the usual way that we had planned because of this in many cases. But in the end, making sure that people who have HIV infection get access to continuous treatment, and making sure that people at high risk of HIV get access to preventive care remain goals that we would like to do safely. So in terms of people with HIV infection already on treatment, what we'd really like to see is how can we adapt our programming so that we absolutely minimize the number of people and the number of visits to facilities. By doing that, we limit the exposure of patients coming into facilities. We limit the amount of people and time who have to work in facilities to receive those patients. And we also allow those facilities to dedicate their time and staff and resources to responding to the COVID-19 epidemic itself. So for many reasons, a guiding principle here is how can we accomplish our treatment and prevention goals in a way that minimizes the contact of our staff and our patients in facilities. So in broad strokes, some of the main ways that we think we can do that are ensuring that we give out the maximum supply of ARVs to individual patients who are on treatment. We'd like to see that be a 6-month supply, so they don't need to come back for 6 months anywhere to get their drugs, but it should be at least 3 months supply. Second, we'd like to encourage people to look at opportunities to deliver those ARVs outside the facility. Instead of having people come to their customary place in a hospital that may be overwhelmed with a COVID-19 response. Can we deliver those ARVs to them in their home? Can we deliver it through a community pickup point? Can we make an arrangement with private pharmacies to have it picked up there? Being creative and adapting how we deliver ARVs to patients is a really important way that we can minimize the amount of visits and people coming into facilities for their ARVs. We know that a lot of prevention services will also be impacted. And so when it comes to a prevention service like PrEP, it's important there that people who are on PrEP be also given at least a 3-month supply. And the check-ins that we usually recommend monthly for people on PrEP, perhaps they can be done by phone or using social media platforms. Again, we recognize these are modifications to the usual process, but that would enable continuity of the essential elements of the prevention services while minimizing the in-person physical contact. There may be other prevention services like VMMC that are impacted in a way that means we delay those VMMCs. Now, I'm not saying to stop VMMCs now, but you have to understand what your local context is and determine at what point you may need to defer scheduled VMMCs because of the impact of the COVID-19 epidemic. We also understand that there's a lot of community-based work. And again, this is about making sure that not only patients are safe, but that the healthcare workers and community volunteers are safe as well. So we've included in the guidance reference to WHO guidance on how to protect yourself, both in community settings and in healthcare settings. And that should be followed as much as possible to ensure safety. I'd like to go over some of these questions that came through on the survey. Some we may have partly addressed, but others not as much. So how can we manage the risk and exposure of the people who work in the field? And there again, I think you need to look at your field work. And is there a way, first of all, that you can modify those services? Is there a phone interaction or a social media interaction that could take the place of what's usually done with a physical interaction? That's one example. And if you are going into communities, you have to be well aware from your health authorities if there is a community-based transmission going on, and that may mean you have to curtail those activities. Number 2, will USAID provide additional funds to local IPs so they can purchase protective materials and equipment to supply facilities supported? So that also relates, I think, to a later question about just the availability of personal protective equipment in general. This is a tough one. There's a global shortage of personal protective equipment. We see it even in the hospital where I work here in the United States. And so there is not a central supply that is going to be made available to programs. So we are encouraging facilities and programs to look at how they can source personal protective equipment as much as possible. There's no plan at this point for routine additional funds for that, but that is something that you would talk to the mission about if there were specific requests and needs. Can outreach activities proceed during this COVID-19 epidemic, though we even have, in this case, 12 cases? Again, this is where look at ways that you can modify how you do your outreach. Can it be done with smaller groups? Can it be done through telephone interactions? Can it be done in a different way that accomplishes most of the goals without the same degree of physical interaction? But we recognize some of these may be curtailed in the context of widespread community transmission. And so you will need to take that into account and be in contact with your USAID mission contacts about the need to modify. Any guidance and funding prepared for the COVID-19 pandemic? So I think this question is less about how we preserve our HIV prevention and treatment services, and more about how can we help countries and their health programs be ready to respond to COVID-19 itself. So I'm going to set that a little bit apart. Yes, there are plans. Yes, the US government has supplemental funding that will soon be made available to assist countries in responding specifically to the COVID-19 epidemic in all aspects. But that's outside the purview of what I'm talking about in terms of the Pepfar HIV response. What will the implications of slowing down in performance be in terms of contractual obligations? Listen, we want you to get as much work done as possible for the benefit of people with HIV and at risk of HIV, but we also want you to do it in a way that doesn't put yourselves at undue risk, and understand that performance may be impacted by this. So we're going to take this week by week. We're going to take this month by month, understand what this impact is, and the mission will be in contact with you in terms of understanding how to judge performance. Timely approval of contiguous plan. Deb, I may need some help on understanding what that's asking, so maybe we can come back to that one. Preparing timesheet and payroll for staff working from home. Yeah, I'm just a pediatrician, so I'm not very good at timesheet and payroll, so that may be something I also defer to other colleagues on the phone to give you some advice about. We have the new guidance on award versus target, where budget expenditure has to be tied to actual work in terms of targets reached. In this pandemic, how do OVC implementing partners proceed, as most staff are now working from home? So here again, I think this ties into part of what we've talked about already. We need to have you think about ways to get the objectives of that work accomplished, perhaps different from how you would have planned or how you would usually do it, making as much use as possible of telephone work, of smaller groups, of social media interaction, and in the end, close communication with your mission agency, AORs and representatives if you're having trouble doing that. So Deb, I can't remember if there's another slide that has questions, or if, oh, here we go. Is there any room for USAID to allow local partners to revise their budgets to accommodate some emerging extra activities? So again, your budgets for that come for Pepfar work need to be focused on the HIV response. And we understand there'll be modification of activities and some realignment as you adapt those activities and services to address the HIV needs in the COVID context. But at this point, we're not talking about you using Pepfar funds purely for a COVID-19 response. Will USAID consider achieving the original targets regardless of the interference? Again, I think we don't have any specific guidance on that other than to say we need to track this together, and I would say are prepared to understand that some targets will not be achievable if you're highly impacted by COVID-19. Is there a way USAID could increase their collaboration with host governments to increase correct messaging and ensure basic prevention interventions? We are working on this in various ways, both through Pepfar channels and outside Pepfar channels. And I agree that this is really important to make sure we both get accurate information out there through governments to their populations, and that we help make sure that updated information is also shared in a timely fashion. If the virus, meaning the COVID-19 virus, spreads to our project site and all staff and beneficiaries are forced to stay home, what possible measures can USAID take for our OVC project? We would really like to look to you to be creative and adaptive in thinking about how you could possibly achieve as much of your OVC objectives as possible, even if you're not able to do in-person home visits. So we're keen to hear some solutions and success stories on that. Guidance on how to ensure patients have their medication for many months now. Job one is hand out 6 months worth of medication now, before facilities are impacted. That's really important. If you can't do 6, then at least do 3. And in the meantime, see if you make sure you have good ways to contact patients by phone or other means, if you can't depend on being in the facility to receive them in the next couple of months. And think about ways to get that medication delivered outside the facility. There are some programs that already have limited programs for external drug pickup points and drug delivery, others that don't. So we need to enhance or find ways to create those sorts of programs. Remuneration during a possible lockdown, that's something that I will have to ask Deb, who can answer that for you. You need sufficient preventing materials. I think that's personal protective equipment. And we talked about how difficult that is because there is a global shortage, and we are asking programs to work with their government colleagues on local sourcing. What are the USAID recommendations for the implementing partners providing community index testing and community dialogues? You know, testing, especially community-based testing, is one of the areas that could be most heavily impacted if there's widespread community transmission of COVID-19. So again, think about ways that you could use more self-test kits, for instance, if those are available, to be able to have those taken to the home without a staff member going there. Think about ways to accomplish the goals that require less in the way of facility visits and less in the way of in-person interactions. Is that it? Oh, no, we have more. Okay. What will happen to projects that do not meet their targets? We don't have a direct answer for that. I can absolutely assure you that if you're adapting, modifying, doing the best to achieve your objectives, that will put you in the strongest position for having Pepfar understand if you don't meet your targets. Can USAID support a safety kit to staff? Again, personal protective equipment will not come from a central source. That is really something that has to be worked on locally. Can USAID allow cost time extension, pandemic period? I don't think I have an answer to that question today. Deb, you can determine if there is someone who could address that. What part are you playing during the COVID-19 pandemic? I'm not sure who the you is, but maybe it means USAID. As mentioned, in addition to USAID Pepfar, understanding how we can do our best to take care of HIV needs despite a COVID-19 epidemic. Other parts of USAID and the US government are also working on how to assist governments and programs with responding to COVID-19 itself. How do we keep operating when the whole project depends on human interaction? Well, this is something that we are all having to adjust to, and there may be some things that are really hard to do, but we are finding that there are many ways to use technology, to use telephones, to use alternative, creative methods that depend less on human interaction to get the job done. How long do we continue to pay staff? So payment of staff, I defer for Deb to let us know who can answer this. Main question is whether soon Pepfar guidance will come on community outreach or whether we should make it up ourselves and ask for approval of adaptation. So we'd like you to have adaptations now. We absolutely want you to follow public health authority guidance in your area. So if they say you can't have groups of more than 10 and your usual community activity involves groups of 50, then an adaptation may be having more frequent groups that are smaller, or again, finding ways to accomplish that through technology, social media, instead of in-person interactions. You should be working on those adaptations now and trying to put those into place. And do please keep your mission agency colleagues updated as you do that. A, so that they can be aware and let you know if they have any concerns about those adaptations. And B, so they can hear some good ideas and share those with others who can benefit from your creativity. How can USAID help IP on safety and security issues? We probably need a little more detail on that question in order to be able to answer that. But as said, we want to make sure that whatever you're doing has your own safety in mind. What do you do if you have a community worker who's affected by COVID-19? So your local health authority should have guidance. WHO guidelines on this is what most public health authorities are looking to, so that we can help make available if you're having trouble accessing it. But anybody who has COVID-19, of course, if they're sick, you want to make sure they contact their own medical provider for their own health to see if they need to be evaluated at the hospital. And then in terms of protecting from and preventing transmission, ideally you want them to isolate themselves within their own home, limit all contact with people outside, and to the extent available, try to isolate themselves from others even in their own home, which we recognize can be really difficult to do. Do we have another slide?
So that's all for the questions we got ahead of time. And thank you so much, George, for going through those. Just to note that we will also be, for anyone who joined a little bit late, we'll be sharing all these slides. It's a recording too that we have, so we can share the recording of the responses. And we'll be following up with written questions and answers as well. So you'll have that as a record. Some of the questions that came in were more on kind of how you pay, your budgeting, your award pieces. And as we noted at the beginning, we are going to also have tomorrow on our webinar, at the end of the webinar session for the last half an hour, some of our experts from our Office of Assistance in Acquisition who can really respond on those types of questions. So we'll hold off on answering those for now, but defer to those tomorrow. And I think a few questions have come in also. Please, if you have additional questions, now's a great chance to input them on the Q&A section in the webinar. So Catherine, would you mind reading out those questions for us?
Sure. We have a question. Pepfar technical guidance on PrEP provision has only referred to clients already on PrEP. There's no guidance on offering PrEP service to those who may want to initiate. What would be your take on this?
Great question. If you are able to still provide the service that allows you to get people started on PrEP, by all means, please do that. I think we recognize that some of the sort of outreach and evaluation that goes into finding people who would benefit from PrEP and starting them, that may be more difficult to carry on in the face of wide COVID-19 related disruptions. But please, if there are ways that you can adapt the services or have that service delivered in a way that follows public health authority guidance and that keeps you and the client safe, it would be absolutely desirable to continue to initiate people on PrEP.
Okay, next question. If a total shutdown, lockdown prevails, how could service delivery be ensured?
So again, you'll have to follow your own public health authority guidance. In the shutdowns that I have seen, or lockdowns in some of the countries, they make exceptions for healthcare workers, both in public and private facilities. So in most cases, the delivery of healthcare services would be exempted from total lockdowns. So again, this is where you will need to think about how to deliver those services in a way that's safe for you and for clients, and focus on what's most essential if you can't do all of them.
That's all the questions for now.
Great. Well, so I'll just end, Deb, by saying it's been really helpful to see these questions. I hope the discussion and the answers were helpful to the people on the call, and look forward to seeing additional questions that may be submitted later so that we can not just respond to them, but understand better some of the other questions and concerns people are facing.
Thank you so much, George. I know it's a very busy time right now, but it's really important for us to have a chance to hear directly from you and for partners all over. I see we have about 100 people on the webinar, so it's a great chance to share directly what's going on. And we'll continue to share. And like I said, if you have additional questions, please send them along. The survey that Catherine through ASAP sent out is still open, so please continue to input questions there. I think, as George noted, it's also really helpful for those working at headquarters level to hear directly, and we don't always have that chance in a large way. So thank you all for putting in the time to ask those questions and give us a little bit of your context and concerns. And so with that, we will pause on the COVID-19. As I noted before, tomorrow we also have a chance to talk about COVID-19 and address some questions more geared toward your awards with our Office of Assistance and Acquisition experts. So stay tuned. I hope everyone will join for that as well. And now I am thrilled to turn this over to Catherine Furtakis, who is in our Office of HIV/AIDS here in Washington, D.C., and who leads up our budget team. And she is going to present on budgeting for Pepfar and go through really some special pieces that are unique for Pepfar that are really important for your awards. So I will turn it over to Catherine, and we will have moments throughout for questions to come in. So please continue to put your questions into the Q&A section. We'll pause at certain points and take some of those questions and then continue. And at the end, we'll have time for questions also. So I'll turn it over to you, Catherine. Thank you.
Great.
Thank you so much, Debbie. Good morning and good afternoon, everyone. This is Catherine Vertekis. I work in the Office of HIV/AIDS in the budget branch. We also are responsible for financial reporting. Let me go ahead and share my presentation now. Okay, so we're going to spend the next 45 minutes or an hour or so walking through Pepfar financial management policies and financial reporting requirements. This presentation was prepared in advance of the outbreak with COVID-19. So these are basic concepts that are going to remain through the Pepfar implementation process and a budgeting process, but obviously there will be some modifications along the way related to Ogac's guidance, specifically on reprogramming within the context of COVID-19. That guidance has been issued to the implementing agencies, and we know that our missions are working on that and could be reaching out to you within that context. But without further ado, we'll go ahead and get started. For the next 45 or so, or 60 minutes or so, we will go over these major points. First, we'll talk about the Pepfar financial management landscape. Then we'll discuss financial management policies. We'll walk through financial reporting requirements, and then we'll briefly walk through the various USAID procedures that have been affected by Pepfar financial management policies and reporting requirements. First, we'll start here with the landscape. You have seen this slide, I'm sure, if you've seen presentations from SGAC, and that is the three guiding pillars related to controlling the HIV pandemic: accountability, transparency, and impact. And you'll see references to this throughout this presentation as Ogac uses these three guiding principles throughout their issuance of policies related to financial management and financial reporting. They believe together all three of these constitute active program and partner management. Here we're looking at an overview of the Pepfar financial landscape here. It's more the budgetary levels set by Congress from 2004 all the way through 2018 with projections there for 2019. Starting off early and transitioning quickly, you can see the first orange line is the budget levels, the annual budgets appropriated by Congress. So you can see from 2004 to 2009, a rapid scale up of funding. And then after around 2010 or 2011, a fairly level budget set by Congress for Pepfar. You'll see starting around 2013 to 2016, we were able to accomplish major expansion by utilizing a pipeline that had built up in some of our programs. And then in 2017 and onward, we've been able to further expand through efficiencies with expenditure reporting. You'll note there the accomplishments with Pepfar lined up next to the budget levels, which is current individuals on HIV treatment and cumulative VMMC. Here we have a quick snapshot of Usaid Pepfar local partner funding, and you can see the scale up from COP18 to COP19. We are excited to continue to expand through what we are currently seeing in the draft budgets for COP20. These are projected levels, and excited to further expand with COP21. This is an overview of the number of awards to local partners. Again, we're thrilled to show that from COP 18 to COP 19, we're seeing an 80% increase in the number of local awards issued by Usaid Pepfar funds. And we are predicting, again, an increase with COP 20. For the next few minutes or so, we'll review Pepfar budgeting and financial monitoring redesign. This is SGAC's initiative that rolled out a couple of years ago, and the three major reasons here are listed on the left. They wanted to redesign their entire financial approach to increase reliability, usability, accountability, and timeliness of financial data to achieve program impact. They wanted to construct a common intra and interagency budgeting and monitoring financial reporting framework that builds upon the pillars of transparency and accountability. And they really wanted to establish these clear linkages between the program cycle to strengthen decision-making, improve coordination, and enable efficiencies and impact. And here you can see the cycle that they designed in order to achieve this redesign. So starting with COP strategy and budget, the next step then leads into IM, or implementing mechanism work planning. Then we are in the cycle called budget execution. That's the actual implementation of our COP. Throughout that time, we are also closely monitoring partner management and then financial reporting. Financial reporting, as you can see, then links into COP strategy and budget for the next cycle. Before we go any further, it's important to distinguish that when we are talking about financial reporting, we can actually be talking about two different perspectives. You may hear SGAC, as well as mission staff, refer to spending and what we're permitted to spend. And we encourage folks to further disaggregate what they are defining, because the term spending can actually be used to refer to U.S. government outlays or partner reported expenditures. U.S. government outlay is a cash disbursement from our U.S. Treasury account to partners as recorded within our U.S. government financial systems. A partner reported expenditure is the dollar amount reported from your partner bank account, reported and charged to USAID. Depending on what time we're talking about, a USG outlay and a partner expenditure can be very different data points. And what we will be spending time today discussing are the USG outlays and the Pepfar financial management policies related to USG outlays, recognizing at this moment that partners may not have access to these USG outlays. Really, the point of this presentation is to explain to you how USG outlays are reported, how they are recorded, and then how SGAC uses these to make decisions. So it's important to understand this part of financial management, although you may not be able to directly affect those outlays or may not have direct access to the outlay reporting. Before we go any further, it's also important to discuss terminology. These concepts will probably not make sense until we have a basic understanding of this terminology and understand the payment process from the perspective of USAID. First, at the top, we'll talk about OMB terminology. You'll hear the term obligation. USAID, we often call it a modification or an incremental obligation. And this refers to a legal agreement between USG and a partner, a vendor, to deliver goods and services. That is recorded in our accounting system. It represents a promise to pay. When goods and services are delivered, it's recorded as what's called a USG outlay. A USG outlay is defined as a cash disbursement from the U.S. Treasury account. Now moving on to SGAC financial terminology. They use the term approved COP budget. When there is an approved COP budget and we report the USG outlay, the difference between those two is pipeline. It's important to note that SGAC defines pipeline differently from how Usaid has been defining pipeline for decades. So they have a different definition. So it's important to understand in the context of conversations that if folks are talking about pipeline, we further have to clarify SGAC defined pipeline versus Usaid defined pipeline. And then there's a concept that I'll also cover called applied pipeline. Usaid financial terminology. In our accounting system, you may hear Usaid staff members talk about disbursements or cash advances. Both of these are what constitute a USG outlay. For the partners who use the letter of credit drawdown, there is the Department of Health and Human Services system called the Payment Management System. This is called a letter of credit drawdown. And then there's also separately the voucher, which is your normal regular invoice that you would submit to USAID for payment. And then lastly, we have here what we would classify as a partner expenditure, a cost that has already been incurred, or an immediate cash need if you're a local partner that receives a cash advance. And these all follow the ADS policies for issuance of cash advances and letter of credit drawdowns. As I mentioned earlier, Usaid pipeline is defined differently from SGAC pipeline. So here we'll show a brief overview of how that works. Excuse me one second. Here we go. We have starting here our Ogac approved budget, either through the COP, the regional operational plan, or the headquarters operational plan, and the example there shows 10. If we have a Usaid obligation or a sub-obligation, again, this is an incremental modification to an award issued to a partner at $9 million. We have partner expenditures, which includes accruals, the amount that the partners have actually spent but may or may not have fully billed to USAID or been reimbursed for. And then lastly, we have what's called the Usaid Outlay, which can be either the disbursement or a cash advance. Using this example here with $7 million for the Usaid Outlay, $8 million for the partner expenditures, $9 million for the amount obligated to a partner, and the SGAC approved budget of $10 million. In the Usaid definition of pipeline, we would calculate that at $1 million. It would be the amount sub-obligated to a partner minus all partner expenditures to include USAID's recorded accruals from partner reports, the quarterly partner reports that are submitted to the AORs and CORs. If we were to look at the SGAC definition of pipeline, it would be a much larger number. It would be the difference between what was approved in the COP minus what has been outlaid at that moment in time. It does not include an amount that has been accrued. So it's important to understand this distinction. SGAC is mostly concerned about the outlay that USAID has issued to the partner, not about the accruals. And so you see the difference here of $1 million for the USAID award level pipeline, and then the $3 million for SGAC's definition of pipeline, meaning if they approved a partner to be at 10 million as an example, and so far USAID has only outlaid 7 million to that partner, Ogac sees that 3 million as pipeline, whether or not the partner has actually spent those funds. We're going to continue on with more pipeline terminology. There is a concept called allowable pipeline. And this is defined as the months of pipeline after 12 months of COP implementation period. So if you're looking at the visual there, the 12 green boxes represent the 12 months of COP implementation, with 3 represented by the blue bars, the blue boxes. This is what SGAC has determined is allowable for any period in time after the 12-month implementation. At Q4, if we are reporting pipeline that is above and beyond what we see here for the 12 plus the 3 months, Ogac defines that as excess, and that is represented by the 3 red boxes at the end. Excess pipeline is the amount above and beyond what is allowable, which is also above and beyond what has already been approved for the 12 months of implementation. At Q4, when we report a level of excess pipeline for each mechanism, that is considered available to apply towards a future COP, which in effect reduces the level of new funds. So it's critically important to understand that if USAID is reporting low outlays, it could misrepresent pipeline as being available for use in a future COP. Continuing on here, just to further explain this concept of excess pipeline, again, it's a unique term used in the Pepfar program. Basically, 2 examples are laid out here. If SGAC approves 10 million annually for a partner and Usaid reported 3 million in excess pipeline as of Q4 of the prior year, the SGAC COP approval will reflect as 3 million in applied pipeline with 7 million in new funds. The second example here, if SGAC approves 10 million annually for a partner and Usaid is reporting 9 million in excess pipeline from Q4 of the prior year, the SGAC COP approval will reflect 9 million in applied pipeline and only 1 million in new funds. Again, this is an important concept that has had some serious consequences if we are not able to reflect the level of outlays within the 12-month period that SGAC has approved for us to outlay. Now we're going to segue into the financial management policies and the recent updates that Ogac has issued. About 3 years ago or so, SGAC issued a cable to all missions implementing Pepfar, and they have since included this similar guidance in each of the COP guidance documents, basically emphasizing that when SGAC approves memos for partner spending via the USG Outlays, it is within a fiscal period, and that fiscal period is defined as October 1st through September 30th. So for example, COP 18 was implemented in FY19, and COP 19 is being implemented now in FY20. So as an example, USG outlays that occur on October 1st of 2019 are counted as COP 19, even if the obligations and activities were related to the previous COP 18. And mechanisms with unliquidated obligations on September 30th must be captured for COP approval, or that mission will need to submit what's called an op plan update for Ogac approval. A fiscal year over outlay occurs when the outlays within a fiscal period exceed the COP approval, regardless of what the actual pipeline may be. SGAC requires mechanism level outlay reporting at least twice a year, and this is done at Q2 and at Q4. And frankly, if there is any perception of us potentially outlaying above and beyond what we're approved, even by just $1, we are required to provide an explanation. So what this has required of us is that within USAID, with all of our AORs and CORs, that we conduct routine reconciliation of partner-reported expenditures against the Phoenix disbursements that we see in our accounting system. And this is because future funding levels depend on the accuracy of our reporting of these disbursements. As I mentioned before, COP19 and COP20, SGAC has issued guidance that the allowable pipeline is 3 months. This is also 4 months for special notification countries. These are excerpts here from the SGAC cable that was issued to all missions about 2 or 3 years ago, explaining that we are not permitted to outlay in any of the 12 months exceeding what has been approved in the COP or ROP, either with new or applied pipeline funds. This is another excerpt from the cable. I wanted you all to see exactly the guidance that was issued by SGAC to the implementing agency. So all of the implementing agencies are required to follow this. And that is that when there's an approval of a COP, it's approval to outlay within a specific period. And it has to include outlays for multi-year situations. And there's only, I believe, 2 missions at this moment that have construction and renovation funds. But it's important that every transaction that might result in a cash disbursement by the US government, it has to be included in the budget. And it furthermore has to be included in the fax info system. This is SGAC's system for monitoring all of their approvals. It's done by operating unit, by agency, and by implementing mechanism and partner. There's a dollar value associated with every single COP and ROP approval, and SGAC expects that we will not exceed the amounts that are approved at the implementing partner level. This is a visual describing the difference between regular financial reporting in US government budgeting concepts versus Pepfar. So here displaying a budget from COP18 of about 4, then in COP19, I'm sorry, it's 2, and then declining here in FY21 is 1. With our transition to local partners, we are not expecting to see this type of decrease, but this is an example just to explain to you how the perspective of SGAC that they're using for reporting, for financial reporting, is going to vary from the way in which we record and report on other programs, non-Pepfar. So here demonstrating an obligation, again, that's that legal engagement with a partner to for goods and services, goods or services. And later, after the obligation of 4, you see an outlay here that can vary from quarter to quarter, as long as the end of the cycle there or the expected period doesn't exceed 4, we're fine. You can see that there are outlays listed there quarter by quarter. Following on to the next year with an approval of 2 as the budget, the obligation taking place in quarter 3, and then in quarter 4, we see the resulting outlays there. You can see that we are not time bound by when those outlays are posted, and that's an important concept that runs through the regular budgeting process in US government programs. Next, we'll walk through the way in which SGAC is looking at outlays. So if we're looking solely at outlays that post between October 1 and September 30th, we're looking at it in slicing in a very different way. So looking at this same example, you can see that if we're only looking at what was outlaid within fiscal year 20, we have a total of $2.75, which reflects 138% of the approval at $2. Again, this is just looking at it in this fashion as time-bound, meaning between October 1 and September 30th, recognizing that most of the outlays that posted in that period were actually a result of activities that were started in the previous cycle. And then you can see again the example with FY21, where the posting of the outlays there also captures some residual outlays from the previous period, which then also results in what is perceived as a fiscal year over outlay. So what has this financial management policy meant for USAID? What it has meant is that we have had to now close the gaps on the parts of our budgeting and outlay cycle that are making us look more vulnerable. So when we have an approved budget that to implement starting Q1, it means that we really do need to get that obligation posted as quickly as possible. We are no longer afforded the luxury of obligating those funds in Q3 or Q4. And so we're working very closely with missions to narrow that gap, to move the funds through our accounting system faster and out to missions. We're working very closely with our contracting officers and agreement officers in order to issue those incremental obligations as soon as USAID receives that funds transfer from Pepfar, from Ogac. And then our hope is that once the obligations have posted, the following outlays will be more related to what is implemented in that cycle, so that we can attempt to close the gap on the outlays that are posting beyond the cycle. What this means is that when we create obligations, we do need to factor in what may not have been outlaid from the previous cycle, and we have to adjust for that when we do incremental modifications for the next year. Obligation and outlay reporting, again, this is from the perspective of the USG. These are reports that are pulled from our accounting system by budget analysts on my branch. We have the same system that missions have, and so we can pull that information straight from the accounting system. We provide that as a draft to our mission staff, who then clear on that before we submit it to Ogac. We report in two different ways. Number one, through a quarterly report on obligations and outlays. This has been a congressional requirement since the beginning of Pepfar, so since 2004. As of Q4 of last year, the report, it totals about $48 billion. And then starting a few years ago, Ogac created a new report. They wanted to see those fiscal year outlays by mechanism within that fiscal period. And we do that twice a year, at Q2, and we do it at Q4. Q4 is also known as the end of fiscal year report or tool, and it includes actual outlays from the most recent COP year, projected outlays for the current year, the projected allowable pipeline of 3 months or 4 months for special notification countries, and then projected excess pipeline that missions must apply to future COPs. This is an overview of the differences between those two reports. Again, this is a USG requirement, pulling information from our accounting system. We are required to use our accounting system, and we are not permitted to use accruals or partner reported expenditures for this report. The end of fiscal year report, as I mentioned before, captures the past, the present, and the future. It covers actual outlays that have posted to the USG accounting system. It projects for outlays within the current period. At the time, this was produced in November, and so it had projected outlays for COP19, and then it has the future, which is COP20. It projects what is the excess pipeline that now must be recycled for that next planning cycle. So what does this really mean? It means that if we report outlays in COP18 that exceed approval, it lowers the amount of pipeline available for COP19 implementation, and it potentially lowers the amount of allowable pipeline for ensuring that that mechanism has funding if there is a gap in funds transfer. And conversely, if COP18 outlays are below approval, it increases what is perceived as available, and it could potentially overstate pipeline and excess pipeline. So it's critically important that our AORs and CORs work closely with you to ensure that when you are reporting to them on a quarterly basis, or that as they're monitoring vouchers and cash advances that are going through, that we are within the levels that are permitted in the COP. We'll spend just a minute here going over the ways in which USAID has had to modify procedures specifically to respond to these financial management policies and reporting requirements. As I mentioned before, access to budget authority. We have previously had a much slower process for issuing funds, the GHP Usaid fund account in particular. We have worked internally to streamline that. So those funds are now being moved much faster than they ever have in the past. We have operating units that have to amend their DOAGs off cycle in order to accept the receipt of those Pepfar funds and then move them to partners. We've issued additional internal USAID guidance for obligating funds to partners. We really cannot incrementally obligate for activities that take place after September, because after September, those funds are covered in future COPs, and our incremental obligations are made at the beginning of the cycle. And then we also had to clarify what this means. What is a fiscal year outlay and what is a fiscal year over outlay? These are terms that we had not yet used in the way that we awarded our contracts and agreements and how we incrementally obligated. And again, with outlay reporting, we've had to phase in systematic upgrades in order to improve the accuracy and timeliness. So this is just an example, frankly, of the many ways that we've had to modify our Usaid procedures. So what does this mean going forward? I've spent the entire time here talking about the perspective of reporting from US government and what's recorded in our system. But really how we can rely on our partners to assist us with this is through the submission of accurate vouchers in a timely manner. Wherever possible, we want those submissions to not be backlogged. We used to be able to afford only reimbursing partners once a month or once a quarter. But if needed, we should be submitting reimbursements to you all on a more timely manner and a more frequent manner. And that is because as soon as we can record that outlay, that is a better reporting to Ogac. We suggest that in the month of September, instead of waiting until the end of September in order to submit for reimbursement in October, we suggest that partners consider a preliminary voucher by mid-September, again, to further align the expenditures on your bank account to what we want to record as the USG outlay in our financial system. We recommend that you converse and discuss regularly with your AORs and CORs related to anything for the USG payment issue. If you're having problems getting reimbursed, if there are lags that need to be addressed, please raise those with your AOR and COR. And then also, lastly, the most important is when AOR CORs are receiving your quarterly reports or your periodic reports, they are comparing that against what we see in our Phoenix accounting system. And if they are recognizing major lags or some concerns, please respond quickly to that so that we can resolve them within the fiscal period. Basically, the earlier that we can identify a problem, the better chance we have to address it within the fiscal period. So I'll wrap up here and say thank you for your time. If you have questions, we'll take them at this time. And if you have questions after this webinar, feel free to coordinate directly with your AORs, CORs, and AOs and COs, who can then reach out to us in the budget branch of OHA. Thank you.
Thank you so much, Catherine. That was great and a lot of information. So I see we have some questions that have come in. I'll read off the first one and hopefully you can respond. And as noted, we will also be compiling all these questions and providing written responses as well.
Okay.
The question is, if a mechanism underspends during COP19 following the COVID-19 outbreak, what possible considerations are there for COP20 budget forecast for that particular mechanism?
That's an excellent question. I have had early discussions with SGAC management and budget about this, and they are willing to be flexible, and we believe they will be likely relaxing a little bit of this going forward, especially as it relates to COVID-19. But we have not received that official guidance yet.
Yeah, I think with all of these, it's still a work in progress, I'm sure. And I know, as George mentioned and Catherine mentioned, there will be continual guidance that will be coming out. So I think George said even twice a week, they're hoping to send out updates. So I'm sure some of this would be included in that as well. Right. Someone asked if we can share the PowerPoint presentation. For sure, we will be sending that around. It's recorded also, so you'll get that recording and the slides and the question and answers afterwards. Let me go back to the questions, and please continue to type in your questions as we're going so we can answer them now. The question is, another question on getting the presentation slides. So I think, again, we will definitely be sharing those slides and make sure that you all have access to these and prior webinars. We'll make sure that we get those sent around, links to the past webinars as well. Any other questions? If people see at the bottom of your screen, there's a Q&A tab. You can click on that and then enter in your questions. Not seeing any others. I know this is a, oh wait, let me just double check. Just a thank you. Also, what is an OPU and what's the process of getting that out? That's probably one of those acronyms that need explaining.
Yes, thank you for catching that. OPU stands for Op Plan Update. So when Ogac approves a COP, it is for the implementation within the 12-month cycle. However, during the time of implementation, a mission may determine that they need to alter or shift funds, for example, from the original plan of a large international partner to potentially a local partner. And an op plan update is the process by which a mission would submit that to Ogac requesting that permission. Once approved by Ogac, they would shift the allocations within the fax info system, both for related to budgets and also related to targets.
Thank you, Catherine. And there's a question that if possible, can we share additional or send in additional questions after they have a chance to look through the PowerPoint presentation again, or have some time to think about other questions? Of course, please send in questions to the organizer. You got the invitation from Catherine Brokenshire Scott. So please send additional questions in. We'll compile them and add them to the question and answer written responses that we'll send around. And a request, which I think is a great one, is there a list of abbreviations of the terms that are used? In Pepfar and Usaid, we have a lot of acronyms. So and terminology, right, that we use that's very particular to our program. I think there is an already existing list that we could share, so we can include that. I don't know, Catherine, if you are aware of any others that are particular for budget acronyms.
I am aware of I think there is a Pepfar app with acronyms and abbreviations. What I can do is go through this entire slide deck and make sure that I have a glossary of all the acronyms used in this slide deck.
Great, thank you. And are the requirements for transition to local partners same for Ogac and Usaid? Same targets, same timelines? And I can address that quickly. Ogac put out the targets for the transition to local partners for both Usaid and CDC The goal is, I think as we've explained on some other presentations, but the goal is 70% of funding should go to local partners by the COP20. That was a goal that we were aiming for, understanding that things happen and you may not get to that exact number, especially you may not get to that exact number in each country. So each country has projections of what they're going to get to, and in the case, for instance, of South Africa, they're already over that 70%. In a country like South Sudan, they are well below that number, and it's probably a much longer trajectory to get to that 70%. So each country really has a different context and a different projection of where they'll get to for local partner funding. And to note that, we're also trying to be flexible if things happen, and for instance, COVID-19 may impact some of that progress. But it is a Pepfar-wide goal for each agency overall to get to that 70% across all countries. And here's another question, I think, similar to what came in and we talked a little bit about with George Cyberry earlier, but due to the corona outbreak, can IPs purchase protective kits for emergency without approval from AO? I would defer that question to our Office of Assistance and Acquisition, who will be responding on questions tomorrow on our webinar. But I think always check with your AO. In country, the folks we'll have tomorrow are Office of Assistance and Acquisition representatives for our headquarters office. They're in touch with a lot of the field AOs and COs, but ultimately the decision rests with those AOs. That is the AO that is associated with your award in the field. But I'll defer that to our team that will answer that tomorrow.
Mm-hmm.
I think there are a couple questions that have come in on the chat. Let me just go back and check. There's a question that says, when should we expect further guidance on paying staff and target issues? I think that's probably also related to COVID-19. Mm-hmm. And I think, as George mentioned earlier today in this webinar, that will come out some in guidance that you'll probably see, especially related to targets. I think the message he shared was really continue to do what you can, keeping in mind, your safety, your workers' safety, and adjusting programs as possible via things that could be done virtually or on phone calls or other ways. So I think more will come out in terms of the target issue, but always, of course, keeping yourself safe, your organization staff safe, and making sure you can do what you can, but having to adjust given your country context. And then in terms of paying staff, I think that's a question also that would be good for our Office of Assistance and Acquisition to respond to. So we'll defer that to those folks tomorrow. It said on a question last time, or when we did this last webinar series, we were promised to get slides and that they weren't sent out. So I think maybe Catherine, you can respond. I think the slides were shared, but let me defer to her. Maybe someone's email got left off, but we will be sure to actually get the slides out and find a way we can provide links to past presentations if you don't have them. Catherine, do you want to jump in on the slides from the last webinar?
Yes, so we did send out all the slides and the questions and answers. If you did not get them, could you kindly send me an email so I can include you on the listserv?
Great.
Thanks.
Sorry for that individual if you did not get the slides. We're really trying to make sure everyone does have access to everything afterwards for your records. And then the question came in on the transition to local partners from 2018 to 19 made a lot of progress. It seems like there's a slowdown from 19 to 20. what accounted for this or what contributed to this. So I think in COP20, we're still trying to get all the details in. Those numbers are not finalized yet, but are sort of projections. But I think if you compare those two slides that were related to the local partner transition, you'll see that the funding has continued to increase at a somewhat similar rate, but just the number of new awards to local partners has not increased as substantially in the COP 2020 projections we have. And I think many USAID missions put into place some new awards in COP 19 and maybe, you know, began them at a smaller funding amount with the idea that they would continue to increase funding with those new awards. So that may be leading to some of the, you know, you're seeing a continued funding increase, but not as many new awards. I think we will continue to track that and update that as we get our COP20 numbers finalized. And of course, we're also looking at what will happen in COP21, even though our Pepfar goals are really focused on getting to 70% by COP20. We're also looking to continue this trajectory into COP21 to continue to increase as much as we can, even beyond the Ogac Pepfar overall goal. I'm going to go back to the chat, the Q&A box. I think there are a couple more questions. And this is a great one for Catherine. Can you explain further the concept of fiscal year over outlay and how it is managed?
Sure, very good question. Again, USAID has had to adjust to this concept, but a fiscal year over outlay is an outlay that occurs between October 1st and September 30th that happens to exceed the approval level for that time period. And the reason that this can occur is if there's a delayed posting within this period that is actually related to activities that occurred in the previous period. And so the reason that Ogac wants to see this is they want us to reserve a certain level of pipeline, and they've calculated very meticulously at the mechanism level how much pipeline we should be reserving for every single mechanism. That pipeline is reserved at USAID's level and is only issued to partners if there are emergency needs and access to funds for the next fiscal year have been delayed. But again, the concept of a fiscal year over outlay is an outlay that just happens to post between October 1st and September 30th that in totality exceeds what was approved for that period.
Great, thank you. Another question in the chat, does USAID allow the local IP to be run by the mother organization? For example, you are a local implementing partner coming or help to be established by another organization or mother organization. So we can share, our definition of local partner is guided by a Pepfar definition that really spells out exactly what we mean by local. And there are requirements for local registration, a number of local staff who are on the board and who you know, are managing the organization. We can share the exact details. So if you meet those requirements, you could be a local organization that has some tie to another mother, you know, quote unquote mother organization that may be based somewhere else, but you have to make sure you meet those specific requirements. So we've seen some cases where an organization is sort of a spin-off from a international organization and does count, but in some cases it doesn't, just depending on meeting those particular definition requirements. I think I don't have any other questions. We really want to remind people to please fill out the survey that was sent by ASAP on COVID-19 questions and context in your country. That's really helpful for us to then give to our teams here who will be responding to questions on question and answer written forms, but also for tomorrow's webinar when you'll have a chance to, again, hear directly from our headquarters Office of Assistance and Acquisition. So please fill out that survey and let us know your questions and your context. One other question that I see coming in, let me see. Oh, maybe that's not anything new. Okay, I think that's all I have unless someone sees other questions. And before we wrap up, we really want to thank Catherine, thank George for sharing from our experts in Washington some of the guidance for COVID-19 and the evolving situation. And Catherine, thank you so much also for sharing about this budgeting aspect. I know it's something that even our staff in working on Pepfar sometimes have questions on and really need to also understand the details of. We have tomorrow an expenditure reporting presentation, which is really also critical and kind of goes hand in hand with budgeting. You need to make sure you're budgeting appropriately and understanding the rules, but then at the end of your implementation cycle, you also need to do expenditure reporting for Pepfar. That's also a very unique Pepfar requirement that all of our implementing partners have to do. It is can be complicated, and I know our expenditure reporting expert, Erin Dunlap, is going to share how to go about doing it, really make sure you understand what's required and how it's done. So please join us tomorrow. As we noted, we'll start again at the same time as today. We'll jump right into the expenditure reporting webinar and then leave a half an hour at the end for questions and answers related to COVID-19 for our Office of Assistance and Acquisition experts. And I see a lot of people saying, please share the slides, share the presentations. If we can make a summary of what was discussed today to share, that's very, very helpful. So some folks who don't have great internet connection, I think, miss some of this. So remember, we will be disseminating the slides, the recording of the webinar, question and answers, and all related materials. So stay tuned for that. I will turn it over to Catherine Brokenshire Scott, our project director for ASAP, for any final closing comments.
Thank you, Debbie. So thank you everybody for joining. We look forward to you joining us again tomorrow. I will send out the presentations within 10 minutes of logging off of this meeting. And we will be developing a formal Q&A report based on all the questions that you've asked. So if you have questions and you think about them tonight, you can add them to tomorrow's Q&A section. As I send you the presentations, if you did not receive any of the others, let me know and I'll send them back out to everybody. Sorry for some people not getting them. I hope next time everybody will say that they got them right afterward. So that's my goal here. And thank you for everybody for completing the survey on COVID-19. It is still open. It's really helpful for you to list your questions there as well. So again, thank you everybody for your participation. We had 101 people on the call today. So thank you for your time and we look forward to talking to you tomorrow.
Thank you. Signing off.
Thank you.